Today on an all-new The Doctors, it claims to get rid of raccoon eyes instantly. We put it to the test.
Hello everyone, thanks so much for being with us. We love to let you know about the latest innovations in beauty and medicine, and we love putting them to the test. This one is a little dark, but not the way you're thinking.
I'm 41 and I'm finally getting married. After all these years, I found somebody who's just amazing, and I feel very blessed to have him in my life. When I look in the mirror, I think, oh my gosh, what do I do about this? The dark circles that you would get if you're lacking sleep. I look like I've been up for days. I get enough sleep. I don't feel tired when I wake up. I feel refreshed, but I always look like I'm just really, really exhausted. I've tried concealer, I've tried revitalizing cream, I've tried puffiness reducer cream, the serums, nothing seems to work. I don't think it helps. I think I look cakey and more tired, and I think it brings it out more. It makes me feel insecure. A lot of people say, oh, you look so tired, or I need to get my beauty sleep. It is very annoying. I'm very lucky with my fiance. He loves me no matter what. And I know I could wear a paper sack, he could care less, but I'm really worried about my photos on my wedding day. I've worked so hard to make everything perfectly beautiful, and I want to look flawless. I want to feel like a princess. I need help.
Please welcome board-certified dermatologist Dr. Jason Emer and his patient Lisa to the show. And Lisa, I know you're anxious for some treatment, so Dr. Emer, what are you going to do with Lisa today?
So she's already numb, and we're going to start by filling a little bit of her under eyelid hollows. But the technique we're doing here is a little different. We're going to be using something called a cannula, so that we only have to do a little bit of movement in one area without getting much bruising. So we go through a little entrance site that's already in her skin, that one little spot that I went in the skin, and I can go into the hollow here directly. You can see where the cannula is and sort of fill that area without any pain or bruising.
What are you filling that area with?
We're using a filler called Bellatero. It's a very soft filler so that it doesn't give a lot of volume here. It just sort of subtly softens the area and allows the circles and hollows to be filled.
Dr. Emer, you're going to follow that up with a laser, correct?
We're going to go to that right now. So what's great about this laser is it's one of the newest technologies. It's a microsecond YAG laser, and what that means is that it quickly delivers heat to the skin, and we were talking about the staining in the blood vessels there. The heat is so fast that it doesn't even damage, but it causes the blood vessels to change, and you can see the pulsing is extremely fast. It heats the skin to allow the blood vessels to flow better and also remove the pigmentation. The results will actually be immediate, so we're going to finish up the treatment in a little bit, and you'll be able to see the end result. She'll look fabulous.
We cannot wait to see it, and the best part is stick around for that reveal, but also Dr. Orden's going to share some tips to prevent raccoon eyes in the first place. Thank you, buddy. We're looking forward to that. Earlier in the show, Dr. Emer started a procedure to help with what his patient calls her raccoon eyes. It's now time to see the results. Before we show you her look now, let's show you Lisa's before picture and now after this procedure just performed in our procedure room. Here is Lisa now, sans makeup. Very, very impressive. What do you think?
Love it.
You've been glowing since you walked on stage.
It feels good. It feels really youthful, rested, bright.
And just wait till your fiance sees it, right?
I know.
So, Dr. Emer, how much is something like this going to cost, and how long will it last? Is this permanent? Is this her new look, or will she have to get it again?
I wish it was permanent, but unfortunately, this will give her about a year sustaining results, which is nice, and it could cost somewhere between $1,500 and $2,500, depending on who you're going to.
And guys, real quick, a couple things people can do.
Topically, some people use antioxidants or something called coffee berry, caffeine, or green tea. Those sort of stimulate the circulation in the area and also help release or lift some of the pigmentation. We use some pigment lightening creams in the office, but I think the way to go is lasers and volume.
We certainly have one very happy customer in Lisa.
Yeah.
Dr. Emer, thank you.
This is Dr. Jason Emer, and I'm with my patient who has some dark circles and under eye bags that he just doesn't like.
I've struggled with this. I've tried creams. I've tried, different concealers and everything, and it just doesn't go away. People always think I've got to do a fight, but it's nothing. So I don't know what to do.
Well, normally in the past, it was all surgery. That was the only option. But luckily now we have a lot of non-invasive treatments. The first part is using some fillers to fill some of the hollows there, volume. I'm going to have you lay back, and we're going to focus on the hollows. So the first step, just a little, 1, 2, 3, a little pinch. These fillers are made of a hyaluronic acid gel, which is a sugar that's naturally in your skin. So there's really no harm to you. Once it's injected, it stays there for about a year. In the past, everyone would have these black and blue eyes for weeks after they had treatment, but now we're literally going in here and just putting a little bit, baby doses of this filler to fill the area with almost no downtime. Are you feeling any pain?
No.
This is great. There's really no reason that you have that. It's just genetic. We're trying really just to fill and lift the area so that it looks much more natural and much more full. So that's the first part, going deeply. Now the second part is to use a different filler, a hyaluronic acid gel. Literally push it where I want it to go, and instantly will fill the upper layer of the skin. And it will have no risk of forming any lumps or bumps. Look down for a sec, and then look all the way up for me. Great. Just gonna do a couple more. We're almost done. And lastly, if you lay back, I'm gonna put a little goggle on you. And this also prevents bruising, which is great, is using that microsecond YAG laser, the LightPod Neo. It's sort of the newest technology in tightening the skin and improving the color of the skin. You don't even need any numbing. It has literally no pain. You're gonna feel a little bit of heat, so keep your eyes closed. And we're gonna just literally start to heat that area. And what that will do is stimulate blood supply to remove some of that pigmentation and get rid of some of those blue blood vessels, as well as prevent any bruising from all the injections. You'll look great. Take a look at yourself and see what you think.
Oh, wow. I do see a big difference. Yeah.
It's great. Let's do the other side.
All right.